Are you tired of nagging, aching low back pain? If you're like some of my patients, then you've been having low back pain for a while, or maybe this is your first episode of low back pain. For some of you, this may be your second or third episode of back pain, and they only seem to be getting worse each time. If that sounds like you, if that's the case, then stay tuned for an exercise program that I've used with my patients for 20 years, and let's see if we can't decrease some of that pain you've been having and get you back to doing the things that you really need to do on a daily basis. I'm Carla Schimmelfin, a registered physical therapist, and welcome to InjuryGuru.com. Did you know that 85 to 90% of all adults will experience back pain at some time in their life? I think that's an awful lot of us. And if you're like my patients, you just aren't quite sure what to do. And the more you mention that your low back pain to people you know, or even strangers, you get all kinds of advice on what you should do, which just makes it a little more confusing. According to Mayo Clinic in a recent study that they did, low back pain is the third leading cause for going to see our doctor. It's only behind skin disorders and joint pain from just simple arthritis. And they have found that billions of dollars are spent every year on treating low back pain. What if you could do and perform an exercise program that could prevent you from having to go see the doctor and spending your money on co-payments and deductibles for expensive tests? Would you be willing to try a simple exercise program that I've used with my patients for more than 20 years? If the answer is yes to either of those questions, then don't turn me off quite yet. Before we go any further, this is really important to mention. So if you're viewing this video right now and you have been experiencing a loss of movement or control in a hip, a knee, or a foot, or you have actually lost bladder or bowel control, then you need to call your doctor right away. That is your body telling you that there is something serious going on in that low back, and those are serious warning signs. So I want you to stop and call your doctor. Let your doctor know what's going on. If you are viewing this video and you're one of those that would say you have that aching, nagging pain across the low back, it may even be to one side or the other. You might describe that pain that's constant during the day, or maybe it comes and goes. Occasionally, my patients will say that pain can be sharp, just depending on what they're doing. Maybe you're having trouble with sitting for long periods of time, so sitting at work or sitting at home. You just can't do those things that you need to do. Then this program is for you. I want you to give this program a try. If you are viewing this video and you're having pain that extends all the way down a leg, or maybe you've even been diagnosed with sciatica from your doctor, then I want you to know that there is still help for you, and I want you to view the videos that I have on this website specifically for sciatica. That's just a little different. I'm going to guide you a little differently through that exercise program. Some of the same exercises, but like I said, I'll guide you a little differently. So make sure, if you're one of those that's having pain all the way down a leg, that you view the videos on sciatica. I'm most excited about this exercise program on this website simply because I run into people every week that say, Carla, I've been having this low back pain. What should I do? And now I have a resource. I have a place where I can put an exercise program together for you, and you can give it a try and see if we can't decrease some of that pain that you've been having. Now, I never tell my patients to buy expensive equipment or expensive gadgets. However, this roll that I'm holding here is really, really important for those of you with back pain. This is called a McKenzie lumbar roll, and you can purchase this on Amazon for about $20, so not too costly. But I have the patients that I see in the clinic with low back pain, I really encourage them very strongly to get one of these and use it regularly. My patients that do use this, they really can see the difference. This is really, really important. If you've had one episode of back pain, studies show that you most likely are going to have another episode of back pain. And using this on a regular basis can actually help prevent further episodes of this low back pain. When you use this, you're going to use this when you're sitting, so in a chair, whether you're at work or at home, or maybe even if you're traveling. You want to put that about the belt level or your waistline. And my patients that use this on a regular basis really can tell the difference and see and feel the importance of using something like this. So this McKenzie lumbar roll. And they take this wherever they go. A lot of my patients will actually purchase 2 of these. They'll keep one at work, and they'll have one at home so that they can use it at home and take it wherever they go. This has a nice strap on the back of it, so you can actually attach it to a chair. Another thing that I encourage my patients to purchase, my patients with low back pain, is this book. And this was by Robin McKenzie, who designed the lumbar roll, and this is just called Treat Your Own Back. You can get this on Amazon too for anywhere from $11 to $15. And some of the exercises that I'm going to have you start with that I'll show you are in this book. I've also added some other exercises in my exercise program, but like I said, if you've had one episode of back pain, most likely you're going to have another episode. And to have this book on hand will at least really be helpful, because you can grab that book and see, all right, what worked for me before, and this is just a really good reminder. This explains a lot of things about the back that I just don't have time to in a video, and it really makes a lot of sense. Most of my patients say, yes, I see myself in this book, and this really helps make everything seem like it makes more sense. So, very useful book. Keep this on a bookshelf where you can always get to it pretty quickly. I'm going to ask you to commit to this exercise program for 2 weeks. That's not a lot of time. And if you can get to the end of that 2 weeks and you would say that your pain is less, you can do those things that you need to do with less pain and just do them a little bit easier, then I quickly want you to go on to the low back exercise program number 2. In that program, you'll see some of the same exercises and then a few new ones. We're just going to push things a little further. And so I just want you to move on to that one quickly if you find at the end of this 2 weeks that you're doing better. So let me show you the first exercise in this low back exercise program number 1. This exercise is called a prone extension, but it just simply means laying on your stomach and bending up and backwards. And let me show you that real quick. So for this exercise, like I said, you're going to be laying on your stomach. Now, for some of you, if you've been having low back pain for quite a while, you're in a pretty good vicious cycle, and you're just having pain most of the day, then just laying in this position can be a challenge for you right now. So you can prop up on your elbows like I am. If that is too uncomfortable, then I want you to lay flat when you do this exercise. Now, for some of my patients, again, those that are in that vicious cycle, I tell them that I actually want them just to lay in this position, so either on your elbows or flat. I want them to I have them lay in this position for several minutes before even starting the exercise. You may have to do that for the first several days. After that, it generally gets much easier, much more tolerable. You may also feel when you first start this, either just laying down or starting the exercise, you may feel an actually increase in that low back pain. But if that decreases, then the more repetitions and sets that you do, then that's your body telling you to keep going, and this is what you need. So I want you to lay on your floor or on your bed, and you're going to just point your toes like that. So if you're laying on your bed, I want you to actually lay on your bed so that your feet can hang off of the edge of the bed. If you're laying on the floor, I want you to take a pillow, just throw a pillow under those ankles, or roll up a towel or a blanket and put them under those ankles. That way I know your feet are in the right position, the position I need them to be in. To start this one, you're going to put your hands on the floor or on your bed right below your shoulders, and you're just going to push up, trying to extend that back up and extend your elbows. So straighten your elbows out all the way if you can. So that's what it looks like. You'll notice my hips are staying on the table. Each time I come up, I pause just a second and try and let my belly button just sag toward the floor, the table, or your bed. Alright, so that's what that looks like. Now for some of you, again, those of you who've been having a good amount of back pain and it's been going on for a while, you might not initially be able to straighten those elbows out all the way. I just want you going as high as you can. After a few days, you'll find, most likely, that you'll be able to go further and further and straighten those elbows out. When you do this, I want you to do 2 sets of 10 repetitions each time you do it throughout the day. And I want you to do at least 3 to 4 times during the day, but you can use this exercise even more frequently than that if it's decreasing your low back pain. Like I said, 2 sets of 10 repetitions each session throughout the day. Now, if you have to go to work and it's just really impossible for you to get on the floor and do this exercise, then stay tuned because I'm going to show you, video number 2 will show you how you can get this movement or exercise done in standing. So don't worry, if you can't lay down, you can still get this one done. So that's it for prone extension, or just laying on your stomach and extending up and back. And I think that's it for this particular exercise. So like I said, let's just get started. You can't change anything until we get started. So view the rest of the videos in this exercise program, and let's see if we can't decrease that pain and get you back to doing all those things that you need and want to do.